ESGCV. My name is Kimberly and I am today's moderator. If you are just joining us, please go to the chat and introduce yourself with your name and the region you represent. As a reminder, this office hours session is being recorded for public record. Office hours recordings are in the California ESGCV past trainings webpage. A copy of the slide deck and recording will be emailed to you. Next slide, please. How to ask a question. All questions must be submitted in the chat box. Please type your organization and question into the chat box. The team will read questions out loud at the end of the presentation and will provide answers, if possible, throughout the presentation. All questions and answers entered in the chat box will be recorded as part of the public record. Alongside our presenters, we also have several HCD staff, including ESG representatives, ESGCV grant administrators, and other consultants who are able to answer questions during the Q&A session. Next slide, please. Today's office hours session agenda includes ESG and ESGCV updates, office hour updates, upcoming trainings, ESG and ESGCV questions and answers, and our Spotlight Series presentation, street outreach policy, and eligibility documentation. And now I'll pass it to Anthony for ESG updates.
Thank you. Good morning, everyone. For those of you I haven't met yet, my name is Anthony Zepeda, and I'm a program representative with the ESG team. I also serve as the lead staff for the annual ESG monitoring program. So if you ever have any questions about the annual ESG monitoring process, please feel free to contact me. Sarah asked me to step in today and provide some general updates and reminders for our ESG grantees and partner agencies. And so with that, we'll start with the updates for the 2021 contracts. If you finalize your 2021 ESG contract with HCD, you are required to enter the contract information into your HMIS. If you're unsure how to do this, you can review the HCD HMIS setup guide. The link is on the slide, and I will also drop the link in the chat. If you've been awarded HP funding, you're required to submit your updated policies and procedures for HCD review and approval. And a reminder that HCD will be unable to reimburse any HP expense until the updated PNPs are approved. If you have any questions about that, or if your contract's been executed and you need help with the eCivis, you can always email us at the ESG NOFA inbox, and we will drop a link into the chat. Next slide, please. Okay, 2021 RFFs and eCivis. Some reminders. All 2021 contracts are managed through eCivis. This means that all RFS must be submitted through the eCivis system by clicking on the Financial Reports tab. All RFS must include the completed detailed expense report, or DER, and your HCD representative will request supporting documentation for a submitted request as part of our mini monitoring efforts. If you're requesting reimbursement for rapid rehousing or HP, this means that we will be requesting complete client files to ensure program eligibility and proper documentation. If you're unsure of what makes up a complete client file, which is not too uncommon, you can review the requirements on the ESG webpage under the Resources tab, and I will drop that link into the chat. And a reminder that please do not upload the supporting documentation in eCivis. This is going to be a little confusing, but all supporting documentation must be submitted through the HCD annual ESG Secure SharePoint website. In addition, make sure to redact all personally identifying information, or PII, from the supporting documentation prior to submitting to HCD. And if you have any questions about the HCD PII policy or the Secure SharePoint website, please reach out to your HCD annual representative or the ESG NOFA inbox. Next slide, please. And now onto the 2022 and 2023 updates. Award announcements will be coming soon, so please stay tuned. For those of you who submitted match exemption applications, we will announce the results at the same time as the 2022 award announcement. And just a reminder that you will be unable to add any additional people from your organization to view the application or the award until the contract has been executed. Next slide, please. Okay, ESG waivers. If you submitted a waiver for any of the items listed on the slide, that's subleasing, rental assistance agreements, or fair market rent, please let us know by either emailing the ESG NOFA inbox or contacting your ESG annual representative directly. Next slide, please. Okay, for new requirements in NOFAs, we are currently in the process of finalizing the 2023 NOFAs, and we anticipate releasing the NOFAs later this month. A couple of reminders related to that. The HCD resolution template. This is generally comes up every year and can be a bit confusing, but we want to make sure this is clear. When submitting your application, your organization must use the HCD approved resolution template. There can be no deviations from the approved HCD resolution template. Now, we know that some of your organization's governing bodies require the use of your own resolution template. This is fine. Just make sure to include the HCD approved resolution template completed and signed by your governing board, along with your own resolution template as an attachment when you submit the HCD approved template. Let's see here, policies and procedures. They are required for all awarded ESG components effective with the 2022 contracts. If you've not already done so, please submit your P&Ps to the ESG team for review and approval. A reminder that we will not be able to reimburse any ESG expenses until the P&Ps have been approved. And for guidance, you can always review the HCD ESG policies and procedures on the ESG homepage under the resources tab. And I will drop that link in the chat. Next slide, please. And on that note, here are a list of some of the resources available on the ESG webpage under the resources tab. The ESG client file checklist. I think that CV needs to be taken off, but we have the ESG client file checklists. We have all of the component manuals in terms of homeless prevention, emergency shelter. We talk about personally identifying information policy. So a lot of resources. Next slide, please. If you have additional questions, you can always reach out directly to your ESG annual representative. You can see we have Diana Prado, Giovanni Martinez, Tuesday Cool, and myself. And if you're unsure who your representative is, you can always contact us directly at the ESG NOFA inbox. And once again, I will drop that in the chat. And that is all of the updates that we have. I hope I didn't go through that too quickly for you.
Thank you, Anthony. And now I just have a few ESG CV updates and reminders. Reminders for the performance milestones, all program funds for projects, street outreach, emergency shelter, rapid rehousing, and homeless prevention must be expended by September 30th, 2023. All funds for HMIS and administrative costs shall be expended by October 31st, 2023. Final requests for funds must be submitted to the department by November 15th, 2023. Next slide, please. Upcoming office hour topics. March 8th, rapid rehousing requirements. March 15th, homelessness prevention requirements, ESG manual. March 22nd, rapid rehousing policy. March 29th, housing stability planning.
Okay.
And so,
I mean, are they okay?
I'm sorry, please make sure that you have your microphone muted. And someone is going to drop the link to register for those office hours into the chat box. Next slide, please. Upcoming trainings for March. March 7th from 12 p.m. to 1:30 p.m. We have the housing problem solving from the new and non-traditional provider series. On March 16th, we have from 10 a.m. to 12 p.m. we have shared housing community workshop series. Next slide, please. And upcoming trainings for April 4th from 11 a.m. to 1 p.m. We have evaluating client eligibility, new and non-traditional provider series. April 7th from 10 a.m. to 12 p.m. We have the low barrier emergency shelter community workshop series. Next slide, please. And then April the 11th from 10 to 12, we have hiring people with lived experience, and that is a racial equity series. And someone's going to drop the link into the chat box for to register for those trainings also. At this time, if there are any questions, please put them in the chat box, and you may continue to put those questions in the chat box throughout the presentation. Okay, I see we do not have any questions. Next slide, please. If you have further questions, to contact us, to contact your annual ESG rep, you can send an email to esgnofa@hcd.ca.gov, or you can contact your annual ESG representative. And for ESG CV, please reach out to your grant administrator. Next slide, please. Now let's turn our attention to today's Spotlight Series, Street Outreach Policy and Eligibility Documentation with Gordon and Shavana.
All right. Good morning, everyone. My name is Gordon Levine. My pronouns are he, him. I am white and Jewish. Glad to be here today to talk about street outreach. Shavana, would you like to take a moment to introduce yourself?
Hello, everyone, and good morning. My name is Shavana McCaleb, and I go by the pronouns of she, her.
All right. Thank you, Shavana. Let's go ahead and get started. Next slide, please. All right. So as usual, when we talk about these office hours series, this is fundamentally focused on subrecipient and sub-subrecipient grants. While ESG is applicable to everyone in the ESG, these trainings, I apologize, are applicable to everyone in the ESG funding stream from HUD all the way down. It's really most applicable to folks who are downstream of HCD, meaning if you receive ESG funding and you're not at HCD, this training is for you. Next slide, please. All right, let's talk about street outreach basics. And this is the basics of the ESG program component, not of conducting street outreach. I think that's worth clarifying. Next slide, please. Turning that over to Shavana.
Thank you, Gordon. The Street Outreach ESG component is designed for providing essential services necessary to reach out to the unsheltered homeless people, connecting them with emergency shelter, housing, or critical services, and providing urgent non-facility-based care to unsheltered homeless people who are unwilling or unable to access emergency shelter, housing, or an appropriate health facility. And you can find this in the ESG interim rule 24 CFR 576 101. Next slide, please. Okay, street outreach overview. The cost of identifying people experiencing unsheltered homelessness, addressing emergency needs, and helping them to return to housing by providing and or referring them to services, including direct returns to housing. Street outreach also can provide services at central locations, such as drop-in centers or in the field. And lastly, the only homelessness, street outreach is the only homelessness dedicated federal source that can provide longer term case management and services to any person experiencing unsheltered homelessness. It's important to note that there are other federal sources that can do almost all of these things. However, ESG street outreach fulfills a unique niche. Next slide, please. And I will turn it back over to you, Gordon.
All right, thanks. So let's talk about eligible participants. Next slide, please. I apologize, I'm sniffly today, so if I'm sneezing at you, that's what's going on there. Eligible participants for street outreach. This slide is going to be, this slide is always misleading. And this keeps coming up, is one of the things I really want you to take away from today. To be eligible for street outreach, you have to meet the category 1 definition. And specifically, you need to meet the unsheltered homelessness part of that definition, which means that you are an individual or a head of household or in a family who lacks a fixed, regular nighttime residence. In other words, you're living in a place that is not meant for human habitation, like your car or on the streets. Or in a tent, or you're living in an abandoned building or a building that's not safe or suitable for human habitation. It excludes 2 other parts. This is an abbreviated version of the definition. It excludes people who are living in emergency shelter, and it excludes people who are currently in and are exiting an institution, such as a jail, a prison, or a physical or behavioral health institution or foster care. It really means it's just for people experiencing unsheltered homelessness. You will see on the slide that category 4 is also listed. Category 4 is fleeing or attempting to flee domestic violence, which means it's everything that's on there. But I want you to pay attention to this. Category 4 is here, and it's important to qualify people under category 4 if they are fleeing domestic violence. But category 4 is a supplement to category 1 for street outreach, meaning you can't qualify just under category 4. You can't be attempting to flee domestic violence but not experiencing unsheltered homelessness and receive services through street outreach. You need to hit that category 4 definition or category 1 definition in addition to 4. So why, might you ask, would you ever bother to qualify under category 4 if you need to qualify under category 1 and category 1 is sufficient for all of your services? The answer is because category 4, once you are certified under category 4, which again, fleeing domestic violence, once you have that certification in place, you become well positioned to take advantage as needed of an array of protections under the Violence Against Women Act. And so there is an advantage, regardless of what outreach program you're being served by. If you are fleeing domestic violence to being certified as fleeing domestic violence, it gives you additional legal protections. In addition to which, a street outreach project, just like any other ESG project, can, in theory, restrict its population served to subpopulations, such as people who are fleeing domestic violence. And so if a street outreach project is dedicated to people fleeing domestic violence, you would necessarily need to qualify under both category 1 and category 4. Those are pretty rare programs, but they are out there. The takeaway here, though, and I'm going to underline, if I could underline this 5 times for y'all. Category 1, unsheltered, is how you qualify for street outreach. Category 4 supplements that with VAWA protections and certain project eligibility, but it doesn't replace category 1. Category 1 is the underlying necessary definition. The reason I'm hammering on this is because it's come up several times this week across different programs, and it's important for me to get it across here because it's easy to get wrong, especially if you're not paying close attention to this slide. So thank you for letting me hammer on that. Next slide, please. So, special note on documenting eligibility for street outreach. This is incidentally also true for emergency shelter. It's handled slightly differently for shelter. There is an FAQ that's linked at the bottom of this page that addresses it both for street outreach and emergency shelter. Street outreach does have the same eligibility documentation standards as other projects, right? Third party first. If you can't get third party, then you do caseworker observation. If you can't get that, then you go down to self-certification, and that's always good, but you have to demonstrate you did the first 2. However, HUD recognizes that third-party documentation is often not feasible for street outreach, and this slide is worded pretty diplomatically. The reality is street outreach, more often than not, is what is providing third-party documentation. It's not requiring it. And you're often going to be getting caseworker observation because you're going to be meeting people in places where they are spending time or clearly sleeping and experiencing unsheltered homelessness. And in absence of that, if, for example, you run an outreach center and someone comes in for the day, self-certification there is the way that you do that. For these projects, for street outreach, and incidentally also for shelter, self-certification is always acceptable, and lack of third-party documentation can never prevent someone from receiving street outreach services, which means if you can't get third-party, you're not supposed to like faff around for a couple of days trying to get third-party certification of somebody experiencing unsheltered homelessness. Unsheltered street outreach through ESG is supposed to be something that you do right now. Right? Someone is in front of you in need, you provide services now. There's a reason that there's a line under street outreach for emergency services, right? This is what we're doing right now to meet basic needs. And so it's not just, you know, you shouldn't get hung up on third-party certification in general. It's if you can't get third-party certification, like immediately, move immediately to outreach. Just keep going until you get somebody certified if they need these services. Next slide, please. All right, let's talk about eligible activities. And I think the idea with the image here is that the umbrella here is the umbrella of activities that you can provide under street outreach. Next slide, please. We're not going to get too deeply into this because it's a pretty broad, it's a pretty long list. Put it like that. But these are your eligible activities under street outreach. Engagement, which includes those emergency services that I talked about that are needed to meet basic needs, as well as whatever is needed to connect with people who are experiencing unsheltered homelessness so that you can begin providing broader services to them. Case management, which is exactly what it sounds like. Emergency health services and emergency mental health services. This, again, is roughly what it sounds like. There are restrictions on what that all covers. I would encourage you to look at the interim rule for a broader look at what that's about. Transportation, meaning the transportation of people who are experiencing unsheltered homelessness, or transportation for the purposes of connecting with people experiencing unsheltered homelessness. And services for special populations, which is the interim rules way of saying all people experiencing homelessness qualify for services, but just in case you didn't understand what all people means, it does include populations such as people fleeing domestic violence. Next slide, please. Go ahead and turn that back over to Shavana.
Okay, thanks, Gordon. And so with ESG-CD, there was additional activities that were provided through the CPD notice. And we will spend just a moment going over those. Next slide, please. The first one is volunteer incentives for necessary COVID relief services. The next one is hazard pay for direct COVID relief services. There's also training to direct services on infectious disease preventing and mitigation. There is cell phone and internet for program participants while in ESG program. It's important to note here that these should be on loan to the clients and be returned back to the community. There is PPE, personal protective equipment for program participants, volunteer incentives up to $50 per person per dose when incentives are not available. Should also note right here that these should not be retroactive paying for volunteer incentives. There's also laundry services for people experiencing unsheltered homelessness, and hand washing stations and portable bathrooms for outdoor locations. Again, all of these can be found in the most recent CPD notice. Back to you, Gordon.
All right, thank you. So let's talk about other requirements and best practices. And I think the idea here was this is an image of practice. I said earlier that this presentation is mostly about what is required, and it is, but we're going to talk about just a little bit of practice in here as well. Next slide, please. Policies and procedures. We talked about that. I think Anthony mentioned a little earlier that you are, if you're operating a homelessness prevention project, required to have policies and procedures and written standards related to homelessness prevention. The same is true for all ESG components, or all participant serving components rather, and that includes street outreach. And so your policies and procedures and written standards should include all of the things that are listed here. Some of this is pretty obvious, right? How you're going to comply with the applicable written standards, what geographic area you're going to cover, how you're going to integrate with the local coordinated entry system, how you're going to document participant eligibility. Some of it is a little bit trickier though. So diversion and rapid exit, those are also called housing problem solving. Street outreach is one of those funding sources that doesn't get a lot of money, but can do diversion and rapid exit, which are sort of longer term case management designed to return people to housing without a subsidy. Housing problem solving is incredibly impactful. Street outreach is one of the only ways to fund it. You are required to do some level of it under HCD's requirements. And so your policies and procedures need to speak to that. How are you going to do it? Who's in charge of it? How do you record it in HMIS and so on? And finally, and this is really the hurdle that I've seen knock folks down for homelessness prevention, your policies and procedures really ought to, in addition to the above, be a record of what you do on a daily basis, a monthly basis, and an annual basis, such that your policies and procedures are easy to be understood by somebody outside the project who picks them up, like a monitor, which is going to happen, but also such that when you're onboarding new people, your new participants or your new staff rather can pick up your policies and procedures, read them, and have a pretty good idea of what you're doing. And that's important for a lot of different reasons, but the reality is that homeless services has a relatively high turnover rate. And having an entire project live in just one person's head means that if that person takes a different job or moves to a different location, you're going to lose a lot of institutional knowledge. And if it's not written down, you'll have to reconstruct the project from first principles. And I guarantee that's not good for your participants. It's also not good for your agency. And so putting some energy into policies and procedures on the front end will save you a lot of heartburn in the back end. Next slide, please. Over to you, Shabana.
Thanks, Gordon. Coordinated entry is a HUD requirement for each ESG funded program or project. What this means is that for ESG street outreach, it's going to vary between COCs. Also ESG, so ESG street outreach is primarily the provider of coordinated entry services. This means your intake, your access, and it does your assessments. And ESG street outreach plays a role in gathering participating eligibility documentation and establishing chronicity. I'll turn it back over to you, Gordon.
All right. As usual, you have to record participant data in HMIS, or if you are a victim services provider, rather, in an HMIS comparable database. There are no regulatory requirements about how soon after services you provide the data have to be recorded. This is especially important for street outreach because there's always a question of like, so I'm supposed to bring my 10-year-old laptop into the field and like provide somebody with services and then pull over on the side of the road and like type into HMIS what I did. No, but HCD or the direct HCD subrecipient or your COC may create state or local requirements for timeliness. Ideally, data is going to be recorded at point and time of service delivery. And so there is an argument to be made for like when you're done with an outreach in the field, you get in your car and you make a record of it there. That ideal isn't always possible due to everything from weather conditions to safety concerns, to just lack of accessible and portable technology. But you really should not, for this or for anything else, be waiting more than a day to enter things into HMIS if you can possibly help it. Just because we know that the longer you wait to enter something into HMIS, the more likely you are to A, forget about it, or B, enter it wrong. So having strong standards for when you enter data into HMIS will ensure that your HMIS data quality is good. Next slide, please. Back over to you, Shabana.
Okay, and for the maintenance of effort, if the HUD requirement is if the subrecipient is a unit or general purpose local government, UGLG, ESG street outreach cannot replace funds the local government provided for street outreach during the preceding 12-month period without permission from HUD. Back over to you, Gordon.
All right. So where do you serve people under street outreach? Feels like it might be obvious, but it really isn't. Street outreach can provide services at a central location or in places where people experiencing unsheltered homelessness live or gather, including other services facilities and in the field. And in the field can mean just like any old place, right? Just anywhere that people experiencing unsheltered homelessness are. And so a question that you get a lot if you spend a lot of time hanging out with street outreach folks is like, which is right? There are arguments for both directions, right? So if you have a central location, you have economies of scale, right? You set up a drop-in center, you run street outreach there, people experiencing homelessness are told about the facility, they come into the facility, you don't have to drive around, you can provide services in safety and comfort for both staff and participants, you can connect them to other services that are provided at the drop-in center. It's a beautiful thing. The disadvantage to that is that, of course, you're only catching the folks who are going to come into a drop-in center, which means folks who can get to a drop-in center and are willing to come to a drop-in center and might be willing to do that repeatedly. And those are actually quite high barriers for people experiencing homelessness. And I know I'm preaching to the choir here, but it's something that we don't necessarily always think of, that things that appear to create efficiencies of scale sometimes create barriers to folks who are least able to access those services. And so that centralized single site model is great for the people who are most able to access services, but it's crummy for people who have barriers to access, people living with disabilities, people who don't have access to transportation, people who live in very rural areas, and so on. On the other hand, if you don't have those efficiencies of scale, you're spending a lot of your time driving around trying to find people, and you're meeting people in locations that are far from your point of origin. So you're seeing fewer people, you're also spending money on transportation costs. And the reality is that there's a safety and security thing, again, for staff and participants that is securable in a single site facility that is not necessarily securable in the field, or it's not securable in the same way in the field. So there are advantages and disadvantages of doing both. The question is, which of them is right? And the answer is, ideally, a system would have a mix, right? You'd have a central location so you could benefit from those economies of scale, but you also need staff going out to other facilities that serve people experiencing homelessness, like job centers, for example, which is a drop-in center. You might not have somebody there full time, but like swing through on Monday, Wednesday, Friday, see who's there and meet with them. Get a room set up where you can meet with people privately. And finally, you do need to get out into the field to meet people where they're at, because there are people, either because that's what they prefer or it's because they can't do anything else, who will not meet with you, who you will not see, who will be invisible to your system if you do not go to where they are, right? And there are lots of reasons for that. I touched on some of them. It's preference, it's ability, it's disability, it's lack of transportation. It's a lack of humility of saying like, all right, if you want services, come to us. Well, not everybody's going to want to do that. They might feel like, you know, if you can't even be bothered to come and meet me, you know, why would I come to meet with you? And conversely, the demonstration that you are literally meeting me where I'm at can be a powerful tool to building that rapport that is necessary to providing good services. So you need all of it. And whether all of it is provided by ESG, or if ESG is a part of it and other agencies, other funding sources are contributing other elements of that, it's ultimately why you need a good street outreach network in your COC or in your locality, with coordination between providers so that you're hitting all of those at once. Finally, we want you to avoid the in-reach trap. And it's so tempting. It's so easy to fall into this trap. The idea here is that you're an outreach provider. You're contracted to serve this many people in a year, and you can serve that many people in a year by staying at your single site facility. Or like, I go to my facility on Monday, and Tuesday I do the job center, Wednesday my place, Thursday this emergency shelter that's funded by like some random non-federal source and they don't otherwise participate in coordinated entry, and Friday back to my own facility. And like, I'm filling up my entire day by seeing people, and my grant is meeting its minimums. So why would I ever like do anything other than that pattern? And the answer is that you miss all of those folks that we just talked about that won't that aren't at those three places that we talked about. That population of folks who are invisible to sort of the lowest hanging fruit of outreach locations are that population's usually among the hardest to reach. It often has the highest service needs and complex housing barriers. And so if you do those things, that there is a sort of perverse incentive to do it, that like that lowest hanging fruit model of outreach. If that's what you engage, you might hit your minimums, but you're not going to be serving those who have the greatest need. In fact, you'll probably be serving those who have the lowest need. And that's not really what ESG is intended for. Next slide. All right, so this is bright red because we want you to pay attention. What is street outreach under ESG actually for? The goal of ESG funded street outreach is to ID people experiencing unsheltered homelessness, provide them with the emergency services and meet their basic needs that they need, and then get them back to housing as fast as possible. That's the goal. Find people, meet their basic needs, get them back to housing. You will notice that I did not mention emergency shelter in the goal set up for street outreach. This is one of the core misconceptions about homeless services in general. But from a street outreach perspective, it's a huge misconception that the pipeline is somebody's experiencing homelessness somewhere. You find them with street outreach, and then you get them into shelter, and then they go from shelter to subsidized housing, and then they go from subsidized housing to permanent housing. It's like nothing, street outreach, shelter, rapid, PSH, nothing, right? Unsubsidized housing. And that's the pipeline. And that's absolutely wrong in every respect. What you need to understand from the street outreach perspective is that a person can go from street outreach to any of those subsequent interventions, and should, but which intervention they go to should depend on availability and also on personal need. Some people don't want shelter. Some people don't need shelter. There's no reason a coordinated entry system or a PHA or anybody else can't take a person who is experiencing unsheltered homelessness and put them into a subsidized unit immediately. There's no reason for shelter to be in there. It doesn't need to be there. Same thing with getting a person back to unsubsidized housing. If a person can go from an unsheltered location back to subsidized housing via case management, via one-time payment using flex funds for whatever, just to kickstart somebody into housing, why would you possibly get them into shelter? Why would you get them into subsidized housing? Those are limited resources. There's no reason to use them unless you need them. Shelter is an emergency response. It's not always available. It doesn't work for everybody. Not everybody wants it, and it's not a substitute for housing. So if your current street outreach program is oriented around like, okay, we find people and we do whatever we need to stabilize them a little bit, and then we get them into shelter, and that's our job, I urge you to reconsider, because it's not what street outreach is for. Everything about street outreach should be aimed at getting people back to safe and stable housing in the most direct way possible, regardless of whether shelter or a subsidy is involved. The goal is housing, and everything else is a question of how do you most quickly, safely, and stably get a person back to housing, which can be directly from an unsheltered location. And I will say, in systems that have strong housing problem-solving approaches, so again, diversion and rapid exit, systems that have strong housing problem-solving approaches get people back to housing from unsheltered locations more frequently than they do get them from unsheltered locations to shelter. Because shelter is a limited resource. Housing problem solving, you can do that with everybody and should be. Thank you for listening to my what is street outreach pitch. Next slide, please. So foundational elements of that, and I'm just going to breeze through these. Housing first, this is a state requirement. It's really about an immediate focus on getting folks back to safe, stable housing tonight or as soon as possible, with a low barrier to services, including eliminating treatment and ID requirements and deploying housing focused case management. Again, how do we get you back to housing? What's the fastest route? Participant-driven assistance is about determining what participants need, want, and will engage, and then providing it. You shouldn't be basing services on a sort of generic model of what people need, because there is no generic person out there. Services should instead be driven about what participants tell you they actually need to get back to housing. Staff readiness and support is critical. This is about onboarding and ongoing training. So again, policies and procedures important, but also like training. Defining your core competencies, which should involve some level of cultural competency, some crisis response and resolution training and culture. And this is a pretty broad category, but trauma-informed care training is sort of a foundational piece of that. And dealing with secondary trauma. Again, preaching to the choir here, but our reality is that everybody who works in homeless services directly with participants and indirectly with participants, but particularly people who do street outreach, really do experience secondary trauma, and that's cumulative. And so addressing that is a necessary part of keeping your team up, running, healthy, and capable of serving folks. IDing your essential services and partnerships. This is really about referrals and wraparound services. The reality is your ESG grant is not going to be able to serve all of your participants' needs, or if it is, you're getting a much larger grant than I think you are. And so you need to ID, what are the shelters in your area? What are the other emergency services? And that includes behavioral, physical health, substance abuse, and so on and so on. But also benefits applications, domestic violence response, subpopulation specific services that are targeted at folks. It's a broad category, but really IDing where your common referrals are and establishing those relationships so that you can pick up the phone and say, hey, I've got a participant who needs XYZ. You've heard from me several times in the last year. And so you've got a pipeline to say, like, this person needs victim services provider response. We need to get this person XYZ. Let's do that. And the person on the other line will pick up and respond to that. Finally, adopting a progressive engagement approach is critical to conserving the resources that you've got. Assuming that anybody who gets into street outreach is going to need every single service you offer is, first, not participant driven, but second, it's going to be a waste of resources, because not everybody needs everything you're offering. Not everybody needs substance use assistance. Not everybody needs a physical health intervention. It might be common. It might be the majority of folks that you're dealing with, but you don't know until you get into it. And so assuming that you've got, put a different way, establishing a baseline of services, this is what everybody gets. And having that be a really small core of services that are genuinely universal, like initial intake, emergency screening, IDing needs for emergency services that are like shelter, health, behavioral health, diversion, like those are your kind of core, everybody gets some services. And beyond that, it's really about engaging participants and IDing what they need individually, and then providing them in an escalating way as interventions either succeed or don't. If they succeed, great, you exit the participant. And if you don't, then you step up gradually. It's a way of conserving resources. It's also a way of being participant-centered and keeping your project participant-driven. Next slide, please. Which I think takes us to Q&A. Let's see, who is our moderator today? Is that LaQuantia?
That is Kim.
That is Kim. Thank you. I appreciate it. Kim, do we have any questions that you got privately or anything in the chat you want to uplift?
I'm looking to see if we have any questions.
I think I see one from Andrea in the chat.
Yes.
Okay, question from Andrea. With regards to places not meant for habitation, what conditions would need to be present in order for a person staying in an RV or travel trailers to be eligible for street outreach services?
That's a great question, and increasingly important as we see a larger population living in RVs and travel trailers and similar. Shavana, what are your thoughts on that?
It's designed for unsheltered. However, we know if it is uninhabitable, no running water, no electricity, things of such of that nature, then yes, they will be eligible for street outreach.
Yep, completely agree. I think the only thing that I would add to that is, generally speaking, when we're looking at RVs and et cetera, or mobile homes or similar, what you're looking for is, do they have a tie down, right? Do they have access to those utilities that Shavana was talking about? So in addition to meeting the habitability standards, a really good clue is just, does it have a tie down, right? Does it have a permanent affixation? And if it doesn't, that's a pretty good clue that it does not qualify as a place meant for human habitation. If it does, it's a pretty good clue that it probably does. You need to do more looking than that, but that's your first clue, and that's where I would start. Great question. Thank you. Other questions, you can message directly to Kim or come off mute, drop them in the chat. We could be done early too. I always worry when there aren't questions, because like, I know that I said things in the last 15 minutes, and Shavana did too, that 5 years ago when I was running an outreach project, or it was longer than that, more years than I would care to count right at this particular moment, when I was running street outreach, when I was a little baby service provider back in the many years ago days. A lot of that stuff would have blown my mind. And I would be sitting there like, oh, I'm gonna have to have a conversation with my team. So if you're sitting there and your noodles have been baked just a little bit, we would love to hear what is baking your noodle and what we can do to help you orient around what street outreach under ESG is, what it can be, what it ought to be. Let's see, I see a question from Andrea. I'm going to kick it over to Shavana first. The question is PPE or personal protective equipment for clients allowable even once ESG/CV is over as a basic need item? Interesting question. Shavana, what do you think?
Great question, Andrea. And I'm gonna say probably not, as it is one of the additional ESG/CV eligible activities.
I think that's a pretty good read of it. I honestly don't know is the truth. I really don't know. The service provider heart of me says, surely it's a basic need. What I can tell you is that the interim rule talks about emergency needs. And so you would really want to define it. If you were looking for eligibility, you would want to look for it in relation to a response to an emergency need. And I'm trying to get, I'm mugging just a little bit. Aaron's got the answer. I'm going to give at the end of this. Well done, Aaron. So here's what the interim rule says. ESG funds may be used to provide essential services to, no, that's emergency shelter. Hang on. See, this is the joy of being a technical assistance provider. You know what's in the interim rule, but you still have to look it up. Okay, the relevant section is 24 CFR 576 101 A1. I'm going to copy the citation. So here's the relevant citation. The section that you're going to look for is addressing urgent physical needs. needs, such as providing meals, blankets, clothing, and toiletries. So if I wanted to get to a yes on that one, I would say an urgent, such as means it's open-ended, and urgent physical needs are open-ended, and toiletries is a pretty broad category, right? And so all of that suggests to me that if you can justify that an urgent physical need is present, whatever you're doing in response to that, within reason, as long as it meets all of the standards of reasonability, should in theory be eligible. But since PPE was called out by ESGCV as explicitly eligible under ESGCV, there is the counter interpretation that says, since it was explicitly called out here, when that goes away, it is no longer eligible. And so what I would do if I were you is exactly what Aaron Rutherford just said, which is submit an AAQ. So the ESG AAQ is a great resource if you have these sort of like down in it questions. I think that's an important question. My intuition is that they've probably had that question more than once, even though ESGCV is still out there. So I would go ahead and submit that. There's a great question in the chat. What is an AAQ? I love that question. So the AAQ it stands for Ask a Question. HUD operates the Ask a Question portal on the HUD Exchange. I'm trying to pull a link up now. It's a way for recipients of various HUD funding to submit a question and get an answer from HUD that is formally, thank you, Chris, 2 seconds ahead of me. It's copying the link. It's a way to submit a question and get an answer that has HUD's stamp of approval. So you get an answer and you can rely on that answer as being functional and true, and you can move forward with it. So the AAQ is staffed by TA providers. We work closely in partnership with HUD. I work on the COC AAQ. I know a number of people at ICF work on the ESG AAQ. I don't know what the turnaround time is, though, since ESGCV is still out there. I would suggest it's perhaps not an urgent need, but if you're wondering about PPE going forward and that's a concern, submitting an AAQ now is not a terrible idea because there is turnaround time on questions, and then you'll have the answer in your pocket for the after times when ESGCV is finally and excitingly spent down. Great question. On the subject of the AAQ, I would say more broadly, when you have a question about your HUD funding and you don't know the answer, and you've talked to HCD and HCD has given you an answer, but part of it is like, well, it depends and you need something a little more specific, you can always submit an AAQ. Always submit an AAQ, and you'll get an answer to your question. The advantage of it, like I said, is that you can't argue with an AAQ response, right? Once you get the HUD response is what it is. And so it's foundational. Once you've got it, you stick it in a file, you operate on the basis of it. You're not going to have like a monitoring that says, well, you did this in this way. If you've got your AAQ, you're covered. The downside is whatever response you get, you have to live with, because it is the official response. So the AAQ is a great resource. I encourage you to take advantage of it. It does provide you with a level of cover, if you want to think about it that way. That once you've got your response, you can act based on it, but you do have to live with the response that you get. And so that's kind of the AAQ in a nutshell. I think it's a great resource. I used it a ton when I was in the community. I always had good experiences. We had a question, can you get the recorded presentation? Yeah, the presentation is being recorded and will be posted just like each other office hours and spotlight series session. Any other questions? I love the what is an AAQ question. Thank you for being brave and asking that question. We live in an alphabet soup sometimes, and I appreciate it when folks uplift that we have not thoroughly answered what our acronyms are. Well, I think we're out of questions. If you have any others, feel free to kick them over to your grant administrator or your other folks at HC, and we'll be happy to address them. Other than that, I think, Kim, time for you to play us off stage.
Thanks, Gordon and Shavonna, for the Spotlight series. Thank you all for your questions. As usual, a quick survey will launch as you exit this session. Please take a minute to reply, as we are always striving to provide useful content and needed technical assistance and training. Have a great day, everyone, and see you on the next office hours.